Okay, let's start the part two of soft contact lens material. So we have already discussed a lot, and then we have to move now. Soft contact lens material part two means soft contact lens. We generally understand it means conventional hydrogel material and silicon hydrogel material. Nowadays, silicon hydrogel material just a whole market, isn't it? Okay, fine. So conventional hydrogel material. So hydrogel material that are made from the gel-like water containing plastic that's called hydrogel, isn't it? Plastic that contains water. It's gel like. And these lenses are very thin and pliable and conform to the surface of the eye. That's why it conforms to the surface of the eye. That's why we don't consider tear lens in case of soft contact lens. Yes, yeah. So it's basically made from HEMA, yes, hydroxyethyl methacrylate, and which is basically lightly cross-linked ethylene glycol diethyl acrylate. So also contain polyvinyl pyrrolidine. So we add another material like polyvinyl pyrrolidine and another things to make it more either cross-linking it or either to increase the water content. So we will later on talk about it. Okay, so conventional hydrogen material is definitely PMA, poly hydroxyethyl methacrylate, and its monomer and that cross-linking such as ethyl glycol ethyl acrylate. So sometimes we do cross linking with other component too. It contains free hydroxyl group that increase hydrophilicity. It's important, okay? It contains that hydroxyl group and that increase the hydrophobicity. So what PMA is actually the first PMA is 38% water content. If greater than 38%, it must be there must be another hydrophilic monomer. So that's what I'm talking about. So it's PMA is basically a 38% water content, and if we have to increase the water content, there must be other hydrophilic monomer that should be added. Okay, so increase the water content, it's not 100% HEMA. So what do you mean by that? So contact lens monomer is not 100% HEMA if we add other hydrophilic monomers. So that's the thing. So when you see 70% water content in any conventional hydrogen, then you must know there are other components added in HEMA to make HEMA from 38% to 70%. Yes, that's the concept. So the monomers commonly used in soft contact lens are, so let's discuss some monomers, okay? Not all monomers, some monomers. Some ethylene and glycodimethyl acrylate. So it cross-linking agent, increase stability and lower H2O level. So it actually lowers the H2O level, but what it does, it increases stability. So it's actually cross-linking agent. So methacrylic acid, what it does, increase water content and hydrophobic because of free carboxyl acid group binds with water. So it also add to increase water MAA, methyl acid. And another MMA is methyl methacrylate, increase strength of hardness and inert. So if I add P, then what it becomes, polymethyl methacrylate, isn't it? So there is no P definitely. So when you add methyl methacrylate, means what PMMA is. PMMA is very hard and inert and very strong material, isn't it? Says MMA gives you strength. And what is PVP? NBP, sorry, and vinyl pyrrolidine. It will definitely increase water content and generally imparts ionic property. What do you mean by that? Ionic property. I will definitely talk about it. Ionic property. So, and vinyl pyrrolidine will excellent with wettability. So it's commonly, you will see commonly in contact lens material, especially hydrogel contact lens. So PVP, polyvinyl alcohol, I know you've seen this component a lot of time. Very hydrophilic and deposit resistance. So that's why we add this. GMA, so glyceryl methacrylate increase the wettability and deposit resistance. Secondary to small pore size, because of small pore size, it resists the deposition. Lower water content, so low decay. We know it. So conventional, what are the advantages and disadvantages of conventional hydrogen material? So first advantage is its comfort, isn't it? One of the disadvantages of RGPs, it's initial discomfort, isn't it? So advantage of soft contact lens hydrogen. I'm not talking about silicon hydrogen. Hydrogel is initial comfort, visual acuity, or conforms affect the little lens movement. So lens movement is little, but in case of RGB, lens movement is huge. Simple to fit, it's always simple, isn't it? Yeah, very simple to fit, and not complicated to examine also. And little adaptation, because RGB lens it needs like 30 minutes. In soft contact lens, even for the examination, we need only 5 minutes, 5 to 10 minutes. Yes, occasional wear is possible. Even so, is it possible in RGB occasional wear? Yes, possible, but in soft contact lens, especially hydrogel lens, we can use even daily disposable contact lens. Yes, cosmetics. Yes, soft contact lens is huge market in cosmetic, especially that contact lens which changes color and all these things. Yes, and minimum spectacle blur. Yes, spectacle blur is mainly because of what do you call it, RGBs, and the RGB changes the shape of the cornea. And when you remove that RGB lens, for sometimes it is actually blurred with you, with even your spectacle. So that's the spectacle blur, isn't it? So these are the advantages. Spectacle blur is not, or it's very minimum as compared to RGB. So, what are the disadvantages of hydrogel material? Bacterial contamination and infection. It's not that other contact lenses do not cause bacterial contamination and infection, but it's very common with hydrogel material, and the incidents are higher in studies too. Okay, so increased care time. Obviously, hydrogel lens need increased care time, and hydrogel lens durability is less, definitely less as compared to RGB, and it's prone to deposit because hydrogel lens, the main way to carry oxygen is through the water, that is through the free water, not a bounded water. So that's why there are pores in between material, there is a gap. Okay, the micro gap definitely we can see through our eyes, and that pore are very favorable for deposits, so it's prone for deposits. Yes, and reduce oxygen permeability in corneal edema. So in compared to the new RGP material, in compared to silicon hydrogel, hydrogel lens has always less decayability. Yes, it's always, like always, because in hydrogel material, I think maximum we can push up to 55 to 60, so we cannot go higher than that. So that's why oxygen permeability is compared to nowadays RGB material and nowadays silicon hydrogel, they are way better. And limitations for corrections. Yes, sometimes hydrogen materials have limitations of correction. For example, high cylinder, definitely. So let's come to silicon hydrogel, which is nowadays the beloved material of in soft contact lens. So it is combined with the conventional hydrogen material. Silicon is an inorganic hydrophobic material. That's what I am talking about in my previous video. Silicon hydrophobic plus hydrogel material, hydrophilic, and whenever they try to combine it, then scientists get opaque, not a clear thing. Okay, with gel, with consistency containing silicon as well as oxygen, carbon, and other elements. The silicon component provides high oxygen permeability to material. That's very important. Silicon component itself hydrophobic, but silicon component provides high oxygen permeability. Basically, silicon, oxygen, and silicon bond. It's basically the structure of a bond that helps to provide the high oxygen permeability. So silicon hydrogen material, the hydrogen component facilitates the fluid permeability. So what do you mean by that? Silicon is hydrophobic. That's why hydrogen component will facilitate fluid permeability and the retention of the fluid and the surface wettability. Then a lot of things. Yes. Thus it provides hydrophilic surface and the facilitate wettability, fluid transport, flexibility, lens movement for the excellent on the eye performance and comfort. Just remember from my previous video, I have already told you, whenever there is a material of contact lens, it must pass fluid from anterior to posterior, it must pass ions from anterior to posterior. If it cannot pass fluid or ion from anterior to posterior surface, then the chances are lens get stuck, lens binds with the contact cornea. So that's the case. So the hydrophilic surface, the hydrogel component will help, that will make sure that contact lens passes. For suppose this is contact lens and suppose this is water molecule, so water molecule passes from anterior to posterior. and at the same time ion passes from anterior to posterior, posterior to anterior. Okay, so that then it will be better for lens movement, and lens do not get stuck in cornea. Or basically, I think I have made my point clear. So silicon hydrogel material in 2007, FDA made the fifth group of FDA, especially silicon hydrogel lens, and groups again divided into three generations. So I think you have to know the first generation, second generation, third generation. Okay, first generation, for example, is balaflicin A and lotraflicin A. Second generation example is phenylphlicin and galiflicin A. Third generation example is comflicin and inflicin A. Okay, so these are the example. And why they are first generation, second generation, third generation, just I think you have to work on that. First generation is surface treatment, second generation is intrinsic wetting agent, third generation itself better. So that's the fifth point, but you have to go and search why they are first generation, second generation, and third generation. Okay, so silicon hydrogen material advantage is extremely important, that is higher decay by T, period. So it's decreased occurrence of hypoxia, which is very important. Easier handling due to the increased rigidity. Silicon hydrogel is, yes, more rigid than hydrogen material, and it includes any design that requires greater lens mass, such as toric contact lens for astigmatism, bifocal contact lens. Yes, these are obviously with silicon hydrogel material. So what are the disadvantages of silicon hydrogel material? Not suitable for silicon intolerance. Yes, if patient is silicon intolerant, it's not suitable. Blurred vision and discomfort due to the lipid deposition. So it's in early, I think in third generation, I don't know, it's still problematic or not. But yes, first generation, because hydrophobic nature of silicon, it creates lipid deposition. See, one of the simple thing and the clear thing that I want to make sure that you understand is, if contact lens is hydrophilic and it's charged, okay, hydrophilic plus charge ionic, then protein deposition is chances of protein deposition is high. If contact lens is hydrophobic and neutral, let's take an example, then lipid deposition is higher. So that's the concept. Okay, so chances of lipid deposition is higher. That's the basic thing you have to understand. So lipid deposition, why we talk about lipid deposition in silicon hydrogen? Silicon hydrogen material is hydrophobic, that's why. Available in limited base curve, yes, in previously, but nowadays we it's getting better. So adaptation problem, initial discomfort. See, to those patients who are comfortable with soft contact lens is very soft, yeah, hydrogel contact lens, and silicon hydrogel has a little bit what do you call, modulus of elasticity is higher, a little bit what do you call, hard, not like RGBs, but yes, definitely it's compared to hydrogel contact lens. Silicon hydrogel contact lens is a little bit harder, so that's why there is adaptation period and initial discomfort. But once the patient gets comfortable with silicon hydrogel, they want silicon hydrogel, and obviously as an optometrist we want silicon hydrogel because of the high decay. So it's important as a student, the classification of soft contact lens material. So basically there are two classifications. Basically classification or nomenclature. Second is nomenclature, yeah, basically. But first is classification. So FDA classification, which is common in, I have already told you, in FDA classification group fifth is silicon hydrogen. In 2007 they add that. So four groups are very important. That is, group first is low water content non-ionic. Group second is high water content non-ionic. First and second group are non-ionic. Okay. Third and fourth group are ionic, and there is alternation of low water, high water, low water, and high water. Third group is low water non-ionic. Fourth group is high water content ionic. Low water means water content less than 50%. Okay. High water means water content greater than 50%. Okay, so ionic, what do you mean by ionic? I'll definitely going to talk about what do you mean by ionic and what do you mean by non-ionic. Basically means, ionic means surface charge is higher. Okay, non-ionic means surface charge is lower. There is amount, a specific amount. I'm going to talk about it. Okay. So is there anything? Yeah, I will talk about it later on. So wait. So now let's come to the nomenclature. So how contact lenses are named, basically. The specific classification of contact lens and contact lens method are given in a six part. Okay. So We never know six, all the six part, but yes, it's very important. What is that six part? It's prefix, stem, series suffix, group suffix, decay range, modification code. Okay, these are six. One, two, three, four, five, and six. Okay, for soft contact lens material, the classification denotes whether the material is ionic and the range which the water content of the material is lies. So these are the thing important. Let's move. Prefix. What do you mean by prefix? It's assigned to the material to designate the specific chemical formula. That is prefix. Stem is flicon or focon. It's very important. Just remember this point. Flicon means like conflicon, inflicon, yeah, like hell flicon. There are a lot of flicon, yeah. So flicons mean it affixed to the prefix and applied to the material which contains greater than 10% of water content. Yes, to call anything hydrophilic, you must have greater than 10% of water content by mass. It's very important. That's why you call flicon. What do you mean a focon? Focon means that it applied to the matter that contains less than 10% water content. That's why in case of RGB contact lens, you will always see name focon. Yes, in hydrogel contact lens, you will always see name flicon. So that's why. Series suffix is used in case in which the original ratio of monomers of an existed contact lens polymer material is changed and make new material. Then you have series suffix. Group suffix is represented by the Roman numericals, okay, and it indicates the range of water content and the ionic water characteristics of the material. So I'm going to talk about group suffix. What do you mean by that? So this. See, group suffix 1 means the water content and non-ionic. What do you mean by low water content and non-ionic? The material which contains less than 50% of water. And what do you mean by non-ionic? Which contain 1% or less of monomer that are ionic at pH 7.2. Just remember this. What do you mean by non-ionic? It must contain less than 1%, 1% or less of monomer that are ionic. Okay, the monomer, there are a lot of ionic and non-ionic monomer. If ionic monomer are very less, it's called non-ionic. Yes, so what are the criteria? It's 1% or less. Okay, there are mix of monomer. If ionic monomer is very less, 1% or less, then it's called non-ionic. Okay, so what do you mean by second prefix? Medium and high water content and non-ionic. What do you mean by that? The 50% material is contain 50% water or more and greater than less than 1% monomer that are ionic at pH 7.2. What do you mean by 3? Low water content and ionic material which has less than 50% water content and content greater than 1% of monomers that are ionic at pH 7.2. What is fourth group? Group suffix, the medium and high water content ionic and material which contains 50% water or more and it contains greater than 1% expressed in mole fraction. Just remember, expressed in mole fraction monomer that are ionic at 7.2. So that's important. So I think you know the concept. What is flicon? Greater than 10%. What is focon? Less than 10% water content. What do you mean by ionic? It means by including let's take an example. 100 monomers are here, like tick 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 tick. Out of 100, so out of 100, if two monomers are ionic, then it will be on another group that more than this group, third group or fourth group. Yes, if less than one or 0.5 or maybe what, maybe example is wrong, maybe one or less, then it will be in non-ionic, because non-ionic 1% or less monomer are ionic. So now what is the group on 0, 1, 2, 3, 4, 5, 6? It's basically range in decay. If less than 1 decay, then it's 0, 0 to 1 to 15, and then 1. It's very, very, very useful. Okay. Then whenever you see the group suffix, group number, then you come to know, yeah, this is the decay. So that's the way. So for example, in order to demonstrate BNS ISO classification system, the AQV2 lens would be classified as follows. AQV2 lens is eta, it's a prefix, eta Falcon, we usually say that. Itafilcon. And A is first time it's done, and group suffix is fourth. It means ionic, high water content, and ionic 2. And decadence in 1. Can you see decadence in 1? It means in this. Yes. And modification code none. So therefore the total name is Itaflicon A fourth 1. Finished. That's how it nomenclature. So let's talk about available hydrogel, silicon hydrogel. So what are the available? So there are a lot of materials that are available, but let's discuss few. So bosenlam balaflicon A, water content is 36%, oxygen permeability is 91, 91. Yes, it's high. Modulus elasticity. Can you see this? It's, my goodness, it's very high, 1.5. See, compared with galliflicon, it's 0.43. So lotraflicon A by Siva Vision, water content is very less, 24. Oxygen permeability, my goodness, 140. See, surface treatment is plasma oxidation, plasma coating, and plasma coating, lotraflicon B2. So these are the things that is important. Okay, surface treatment is there in first generation, and see in confligen, I think it's third generation. Water content is good, 48%, 48%, yes, and oxygen permeability is very good, 180, and modulus of elasticity in compared to balaflicon, it's like half, isn't it? 0.7, and there is no internal weighting agent is added. So principal monomer, you can just look at here, and these are things. So this conflict is definitely third generation. Yes. So given by bioaffinity. So let's discuss about few things. I think it's group 1, group 2, group 3, group 4 according to FTA group. What do you mean by that? According to FTA, we are talking here about the group suffix, okay, in BSE and ISO. We are talking here FDA group. So in FDA group, less than 50, group 1 less than 50%, group 2 greater than 50%. In ionic, non-ionic, it's less than 0.2 ionic percentage ionic content. It's important, okay? So basically ionic content is less than 0.2% of ionic content. So in case of group 1, there are materials like, see, so Biomed, Optima, Durasoft, Softlens 35, Softpin. So what are the content? Hema plus Ma, EMMA, and these all things. Water content 38%, 48. Just see these things. Okay. So what are the UNS nomenclature is polymacon, tetraflicon, and these all things. Okay, polymacon. These are group first, and group second is greater than 50% water content, and ionic content is still 0.2, less than 0.2% ionic content. So these are components like hexaflicon, sulflicon, alpha-flicon, elaflicon, and lidoflicon. Just see all these things. Pause the video and see things. Okay. So group third is less than 50% low water content. At the same time, ionic is greater than 0.2%. Now it's ionic content. So common example is filmiflicon and buflicon. So see which are the contact lens and contact lens and contents. Okay. So other is group fourth. Group fourth is hit group. Okay, what do you mean? Group fourth hit contact lens in current time is Itaflicon, which is very famous material. Greater than 50% water content, and ionicity definitely 0.2%. Greater than, it's high water content ionic. Yes. So it's given by Johnson and Johnson. So name is AQV. So another is Femiflicon A, Durasoft by Siva Vision. So just try to understand this water content, how much water content they have. These are the important things. Okay. So now I finished the soft contact lens material. These are my three best book. I always love this book. Yes, Efron, and it's Edward S. Bennett, Clinical Manual of Contact Lens. Yes, this, I don't know, great book, Contact Lenses by Philips. Yes, so and Speed Well. So these are the three books, are great books. I think no optometrist should avoid these three, all three books. They must read all three books for contact lenses. Okay, so that's it. Bistan, choose.